But I always noticed that you were not allowed to criticize the pill, period. And now I feel like maybe we were played a little bit.
You've got the pill and it just goes hand in hand with the rise in the hand of industrial agriculture. You know, the spraying of these pesticides. You've got these medications that are literally shutting down the hormones in the female body that create this cyclical life-giving nature of women. We basically told women these hormones don't matter. Your ability to create the most miracle of any miracles, which is create life, just shut it down. There's no impacts. Your cycle and having these hormonal cycles is part and parcel with our health in every possible way, and also with the miracle of creating life. And so for years, you just lose the biofeedback of what's happening with your cycle. It is one of the key barometers of female health. How is your cycle doing? Is it regular? Is it heavy? And we just shut it down and say there's no repercussions for that, which I think gets to a larger issue, which is a disrespect of life.
Well, Tucker Carlson, I want to say, I agree. All right, let's break it down some of these points. When Tucker said that it was like you weren't allowed to criticize it, I believe the reason why you weren't allowed to criticize it, because if you ever think of it this way, the main treatment still to this day for any hormonal problem, especially if you're in your teens or 20s, is to give them birth control. So why are you going to criticize the number one thing that you're giving out like candy, and they're giving prescriptions out consistently? So I understand why they didn't criticize it, because if someone had irregular cycles, someone had acne, instead of actually finding what was going on, they literally just hand it out. So they're not going to criticize it. Second of all, I totally agree with them when they talked about it creates a biofeedback to where now you have the pituitary not releasing LH or FSH, so therefore it negates the whole female cycle. Another point I actually loved was the fact that you're right. When you do deal with a female in any form of healthcare, you're going to ask them, okay, how many days did you menstruate? What is your cycle like? What's your emotions like? Did you ovulate? And all those things are a cyclical pattern that can be mapped out. And if there's some healthcare conditions, it's going to throw them off. And there has been a lot of us that have criticized it for 25 plus years, because these things are classified as endocrine disruptors. And there's no way that you can endocrine disrupt female hormones back to normal. So I think this video, they did a great job.